Hey, hi guys, Dr. Dan Nightingale here, your clinical dementia specialist. I hope you're having a great day, a great week. I certainly am. Today, I'm going to focus on one of my quotes that you will find posted on Facebook and Instagram, and I'm going to kind of elaborate on what I mean by them. So today's quote: the greatest gift you can give someone living with dementia is your time and patience. Now, this is a pretty wide subject because obviously we have to use time, we have to take time, we have to be very patient, we have to be, we sometimes have to change our own self to ensure that we're meeting the needs of somebody who's living with cognitive change. So what I want to think about here is, how do we do that whilst maintaining our own mental health? Or if you're a caregiver, what I'm saying here, talking about caregivers, how do you maintain your own mental health? Some people who are living with dementia have such high anxiety and such fear that they will follow their husband or wife or son or daughter. They'll follow them around all day long. You can't go anywhere without them following you because they're frightened, because they're anxious to be left on their own. That's understandable, isn't it? If you think about, the two fuels that feed the symptoms of most dementia type illnesses, such as Alzheimer's disease, is anxiety and fear. So if you can help dampen down the fear and anxiety, then the person feels a little bit more secure and safe within themselves. I can't tell you how to do that because everybody's individual, but some of the ways we do that are through relaxation strategies, making sure people are have eaten properly, making sure they're hydrated, making sure they've taken their medication, making sure they're in a safe place, doing something that they enjoy and they like and they can focus and concentrate on, which is all well and good for those guys. But for you, the person supporting that person living through that journey, you must also protect your own mental health. You must find time for self. And even if that's 10 or 15 minutes of sitting outside in the garden, breathing, and just getting in touch with self and being rather than doing, that has a massive impact on your vagus nerval system. Okay? Your vagus nerve is a branch of nerves that runs from your brain all the way down your body and branches out to various organs. So if you're stressed, if you're anxious, if you're afraid, that's impacting on those organs. It's upsetting your systemic system and your mental health. Okay? So make sure you have time to self. Whatever that looks like for you, make it a priority. For people who are living with dementia, we want to support them. We want to make sure their life is as comfortable and as productive and as enjoyable as possible, right? So to do that, just ensure that they're happy, they're in a good place, they know what they're doing, they've got something that keeps them happy and occupied. Maybe they like watching old movies, maybe they like watching comedy shows, maybe they like reading. Whatever it is, get them to focus on that activity while you have some self-time. Okay? That's where I was going with that quote. So, remember that. Look after self as well as the person living with dementia. It's a journey. There are many, many people supporting you on that journey. Nobody, absolutely nobody should ever be alone. They should never feel it's just me. I'm on my own supporting this person. It should never be like that. If it feels like that right now for you, let me know and I will tell you how we can change that. Okay? So never ever think you're on your own. There's a lot of support around. There's a lot of available groups. There's a lot of people with experience, a lot of people living exactly the same experience as you, so you're never alone. And if you feel that way, I don't want you to feel that way because it will make you sick. So let me know and I will help you with that. Lynn, do you have anything to throw in there?
What if your family and friends don't understand why you're not available? Why are you stressed? Why are you, why don't you just get somebody else to do this caregiving?
Good question. It's all about education, isn't it? Education, understanding, and this is why we do this YouTube channel, so that people can learn, people can understand, people can have an insight into what it's like. I think for people who don't understand and who think you can just go and get somebody to come and care for that person, there's some education needed there in terms of compassion and in terms of what is the lived experience of somebody who is going through this journey. What is their lived experience? And once people recognize and understand that, then their attitude changes towards that and they become more supportive rather than distant. I know some people tell me that their friends have become very distant. They don't visit them anymore. They don't call them anymore. They don't go out with lunch with them anymore. And it's all about education. It's all about people not being sure what to say to people or how to be around people and things like that. So some straightforward, basic, fundamental education for people is paramount. And there's loads of it around. A number of years ago, England, the UK brought in something called a Friends scheme. Now, I know scheme is a bad word in America, but in England we use that to mean a project. And what that was educating so many people in the community about dementia. Shopkeepers were all trained to recognise and understand that somebody has a cognitive issue and to help them and to support them. So many people attended that training programme and become more aware of that and learned how to signpost people into the right directions and things. So there's many support groups and there are many educational services, especially through the Alzheimer's Society, the Alzheimer's Association, age concerns and those kinds of organisations are all there to provide some help and support and education. So that's really good point and a really good question. Yeah.
And also, if you find yourself burning out, say something to your own doctor because it can affect your own health. But if before you burn out, because ultimately there's going to be a day when you burn out or have a rotten day or a tough day, isolated here and there, but notice that you need to start enlisting help in advance and start making plans to get more support, because you're going to have a down day. You're going to have your own doctor's appointment, your own things that you have to take care of. So
also on that note, just thinking of issues that I've dealt with recently, not all family members understand what the immediate caregiver is going through. So a husband who is supporting a wife, or a wife who is supporting a husband with children, adult children that live in a different state or don't contact very often, sometimes they don't understand what is happening and the challenges that immediate caregiver is experiencing. So it's very important that when somebody is diagnosed with Alzheimer's disease or other kind of dementia, that a bit of education is given to the family, that they have a grasp of the basic fundamental education around supporting somebody and around the challenges and around the issues that people are experiencing. And as I said, fear and anxiety is a massive one for everybody. Fear of the unknown, fear of what's happening to me, fear of not being able to remember something, fear of thinking that you've said something and you haven't, or saying something and forgotten you've said something. And somebody who is being followed around all day long and who gets constantly harassed. I guess harassed is the wrong word. That's a negative word. I'll take that back. Not so much harassed, but
constantly being watched, or
Yeah.
someone's being overly attentive
Right.
because they're nervous
Yeah.
or anxious,
Yeah,
and the
thanks.
other the person feeds off of that
Absolutely.
anxiety.
That's it. Thank you for bailing me out there, Lynn. Yeah. So I think that is a really important point, making sure that people do have some education. And very often I will have consultations with families. Lynn arranges that. She schedules for me to have telemedicine consults with families, or they come into my office and we have a conversation about the challenges that people are experiencing and how we can best support them. You can hear my dog Buddy snoring away.
And
I've
oftentimes,
sent him to sleep.
and oftentimes, let's say a parent that has dementia is living with their adult child, and the other adult children live in other places or states, and those other siblings have no idea what the sibling who lives with that parent is going through or experiencing. So a good idea is to bring them all together
Right.
to talk about it, and you do that
Absolutely. Often, yeah, it's a big part of my role as a clinical dementia specialist, indeed. Yep. Okay, I'm going to wrap it up there. Thank you for tuning in. Please share this video with anybody and everybody. Share it with the world. Get people to subscribe. This is a free, valuable, useful resource that people can get lots of education and information from. We're maybe 170 videos now or something like that, long videos, short videos, quotes, posts. There's always something happening on the YouTube channel or Instagram or Facebook. And if you have any topics you want to bring up, please let us know. In a few weeks, we're going to be doing another Q&A session. So send in your questions and we can start putting those together. And remember, it's summertime. It's very, very hot in Arizona. So if you're in Arizona, stay hydrated. Well, wherever you are in the world, if it's hot, stay hydrated. Drink lots and lots of water. Something that Lynn reminded me, if you get bored with drinking water, because we do have to drink a lot of it here at this time of year, if you get bored with it, go for watermelon. Go for, you can get some
Popsicles.
some popsicles, because you can get some powder that flavours your water. You know, I'm happy for you to use that.
Fresh fruit in your water.
Fresh fruit, yeah, absolutely. Coconut water is fantastic for hydrating. So,
And
go
if
for
you don't like
coconut
the
water.
taste, they have flavored coconut water
Oh, good.
that has other fruit flavors.
Oh, there you go. See, that's cool. I didn't know that. Thank you. Okay, guys, have a great week. And remember, say it with me. Dump the soda.